Hi, welcome to another episode of Making India Heart Strong, Experts Speak. And today we have Dr. Dixit Garg with us, and we are talking about women and heart health.
I am Dr. Dixit Garg, and I am a consultant intervention cardiologist, and I've been practicing cardiology for past 11 years.
What are the most common heart diseases when it comes to women?
Before we dive into this topic, I would like to first summarize the structures that are present in heart and the conditions, various diseases that are related to heart, because most of the times the issue that is highlighted by the media is the heart attacks or the coronary artery disease. The structures that we see in heart are the arteries, of course, which everybody is quite aware of nowadays. Uh, Beyond that, we deal with the function of the heart, which we can assess on echocardiogram. There are electrical problems of the heart as well, and there is a layer around the heart which is called pericardium. The disease that affect this part of the heart are again different.
Doctor, can we just start with what are the most commonly seen heart diseases in women?
Yeah. Now that we have established the various kind of disease that we see in women, with the most commonly addressed problem in women is the coronary artery disease. So in women, we see the incidence of coronary artery disease after 50 years of age. But however, the women, of course, they have altogether a different lifestyle than men. They go through a very important period of life, which is childbirth. So at that time, due to pregnancy and due to hormones as well, the heart function may go down. It usually is temporary and transient, and usually it improves within 6 months of childbirth. However, sometimes the function remains, less, and it is compromised for the whole life. Of course, we can manage it with the help of medication. So this condition is called pregnancy-induced DCMP, or dilated cardiomyopathy.
Doctor, since you're talking about childbirth and hormonal changes, do you think women going through perimenopause and menopause, they are also at the risk of cardiac diseases?
Yes, the patients or the ladies who are particularly using OCPs or the oral contraceptive pills for or the hormonal therapy for some reason, they are at increased risk of having cardiovascular events, especially hypertension. Otherwise, the female hormones are considered to be protective for coronary artery disease. The blockages are seen less frequently. That's why the incidence is seen later and less frequently in women. However, it can lead to rise in incidence of blood pressure and the decrease in heart function, as I mentioned, the dilated cardiomyopathy. So that reduction in heart function is not due to blockages; it is due to hormones that the heart becomes. The heart pump function gets affected.
Changes according to which phase in life you are, and it's constantly changing.
It's
It was
constantly
hormones.
changing. Yes, the life of a woman is very different from men. I mean, it keeps on going through different phases throughout their life.
Doctor, in that case, since let's talk about when the period starts till the time your menopause is ending, there's so many hormonal changes happening in a woman's body. So, when do you think, at what age, women should start getting their tests done regularly, especially heart specific, cardiac related? What is the right age to start going for those tests? And also, if there are some certain checklists that we should keep in mind for that case?
Basically, we assess for heart disease when the patient is symptomatic, when they typically complain of some problems. So it is very commonly found that a patient, they say that their stamina is reduced, they're feeling fatigued more easily, they're not able to carry on for much longer duration during the working hours. Then we assume that yes, there may be some problem with the heart function. So otherwise, if the patient is not complaining of anything, they are leading their lifestyle very well, they're not facing any difficulties in their daily routine, then we usually recommend them to be tested either during pregnancy or after the age of 40-45 years.
So it's an interesting marker. 40, 45 is the time when women should start paying like little more extra attention.
Yes, of course. One can always pay attention towards the lipid, the cholesterol levels and the sugar, because that is not related to the incidence or the age. That can have that lipid profile is deranged in quite a lot of youngsters nowadays.
How does then one take that first step towards better heart health, especially if it's a woman, especially if you have, let's say, house stuff to take care of, you have deadlines, you are catching up on things that give you some kind of entertainment because you do want that. So, what is it that women can do, which is like, even if it's a small change in their 24-hour cycle, that will actually make an impact?
So I usually tell my patients, especially the youngsters, that you have to find a way or find at least half an hour for yourself, which is totally your time. There is no other commitment. So our literature also says that you don't have to work out 2 hours a day. You just barely have to take 30 minutes of your time for 5 days a week, not for the whole week. So even when you have to engage in moderate intensity exercise, so which includes your cycling, swimming, jogging. So these kind of activities are most helpful. So it can, of course, it will keep the overall health in check. Means your fitness also goes up, and the probability of having disease also go down. So morning is the hour when you should take your time out, because evenings are typically not predictable, and you're tired by the end of the day. So start your mornings, take half an hour of your time out right in the morning after sending the kids to the school, or so just take half an hour out of it of your time right in the morning.
So I'm hoping all the ladies are listening. It's 30 minutes, 5 days a week. That's what you need to get started. What you do after that is completely different, but at least get started,
Yes.
right?
And one more thing I would like to add. I've seen from personal experience, I'm saying, please don't take it other way. What I've commonly observed is that women typically do not like to jog or go for brisk walking. Yes, they like walking, but however, they require either company, so that while walking they're talking to someone, or either on phone, or the person who is walking along with them. See, what happens is that is completely fine. However, if you make an observation that when you're walking alone, you're more focused on your breathing, on your effort. There is nothing else on your mind, right? But when you are talking to someone while you're walking, you will not be able to exert yourself that much. Right. So it's very simple. I mean, if you're talking, you will not be able to push yourself to the next level. So that is not going to really work out. You may walk the whole day, it may not have any effect. So exercise is as simple. I'll just summarize the typical how a typical exercise would feel like. Your heart rate should go up, your muscles should feel the strain, your respiratory system, your respiratory rate should go up, and you should be sweating. So that is what that means. You're exercising, you are making an effort. Right. If however, this can be due to weather as well. So but if you're feeling the stretch in your muscles, that means
you've done it.
Yes, 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 you're
that's
hitting
a
the
good
spot.
start. That's
Yes.
a good start.
So but people are very obsessed with the numbers. Yes. So don't get into those numbers. Try to just follow the basic physiology. If you're making an effort, your heart rate will go up, your respiratory rate will go up, and you will start sweating, and you will feel stretching, your muscles stretching up.
So basically, feel that soreness. Yes. And break into a sweat.
Yes.
Those are really helpful tips. I think breaking into a sweat is very, very important, and feeling that soreness. But I do want to understand that why is it that women sometimes tend to not recognize the symptoms, or even if something is happening, they tend to ignore it, or it goes completely undiagnosed. A, why does that happen? What are the ones that we should be looking out for? And B, like, how to just keep that in mind that this can be a sign of a heart disease or some issue, and it's not just gas, which most of us tend to say.
So very rightly pointed out, that's a very common mistake that people do. and unfortunately, the consequences can be very grave. So, if you are feeling, even if you're feeling, if you even if you can make out that it is gas, still seek a consultation from your physician, even not your cardiologist. Just seek opinion from a family physician that I'm getting these symptoms. So, are they worrisome or not? And a few basic tests should be able to help you make better choices. There are four cardinal symptoms that we say. Either you will feel that the breathlessness while walking, while exertion, maybe you are climbing upstairs, or maybe going for a walk for half a kilometer or a kilometer, or you may feel heaviness in the chest. It's not typically pain, it's a suffocating kind of a feeling that you get when you walk. Some people tend to get palpitations, and some complaint of lightheadedness, that whenever they walk, they feel kind of giddy, kind of dizzy when they exert. So these are four symptoms that are typically described in our textbooks. Uh, all of these symptoms will happen on exertion. So, if they are happening at rest, there may be some other pathology, or the condition has already progressed far, ahead, that you're already late in seeking, a treatment. So, if you're feeling all this, typically while exerting, you feel that for past 3, 4 months or 6 months, the stamina is constantly been going down. That means something is going on.
Got it. But, doctor, what puts women at a higher risk? Like, is it genetic? Is it hormones? Is it something that is lifestyle related? Is it a combination of everything?
Yeah. So yes. So I think I missed out a few conditions that are more prevalent in women, which is your congenital heart disease. That means there are certain conditions which are present right from birth, but they may trouble you in third or fourth decade of life. So typically, there is a condition called ASD, atrial septal defect. There are four chambers in heart. The upper chambers are called atrium. The lower chambers are called ventricles. So all these chambers, the left and the right chambers, are separate from each other. The upper and lower chambers are connected to each other through valves. So the upper two chambers, which are the atrium, they are separated by a septum, or there's a wall in between them, which is called intraatrial septum. So there is a defect in them. So there is a hole which doesn't fill up in some patients. So that will lead to diversion of flow from the left side of the heart towards the right, and then to the lung. So the blood which is supposed to flow to the rest of the body will keep on circulating between the heart and the lung. So this will gradually build up to a point when it starts troubling you in the third or fourth decade of life. That is one thing which is more commonly found in women.
And this is something that you're born with. You
Yeah, you're
can't
born with.
really
Yes,
do.
yes, yes. You cannot do it. It's not
And
related to,
why is it so difficult to like diagnose it?
because nobody expects these things, and young people keep on compensating for quite a long time. It only once the body starts giving up later in your life, then you test them, and you find that you find out.
And this is something that you're saying is more
More
common
prevalent,
in
yes,
more
in women,
prevalent in
yes.
women.
Now that we're talking about it, you may as well electively check yourself. That's all. Just one single test will, assure you that
Yeah,
things are all
precaution
right.
is always
Yes,
better.
yes.
So these are very helpful tips, doctor, I must say, and it's very important for women to understand that their bodies will change and it will affect their heart. But there are a lot of silent symptoms that we keep hearing about. So what are the key things that one should keep in mind?
Right. So, four symptoms we identify in a patient in whom we suspect heart disease. First is chest heaviness, which may affect you from the lower jaw till the umbilicus. You may feel that discomfort in the middle of the chest, but you may feel it in both the shoulders, in the back, or in the lower jaw as well, sometimes, which is mistaken for a toothache. So if you're getting the toothache or the jaw pain while walking, then it may be a sign of heart disease. The next symptom is breathlessness, undue breathlessness, I would say, that you're not able to carry on with your routine activities as well. Third would be lightheadedness or the dizziness, and fourth is palpitations.
Doctor, while you were talking, something came up, and I do want to talk about it because I feel like it happens in women more often. They go for some test or some other condition, and the reports come, and the doctor tells them, "Oh, you had a heart attack, or you had like this incident," and women don't even come to know. How does that happen? Like you're having a heart attack and you don't come to know. Like, what are the things that women tend to miss
Actually,
out?
just by looking at ECG, yes, there are some changes. There are some definite changes which can give an indication that a patient, the person may have suffered from an heart attack previously. However, quite quite often there are ill-defined changes. Those changes are not very specific. So, without testing further, one should refrain from, you know,
Calling it
this.
a
Yes, calling it a heart
yeah.
attack. Yes, because yes, it generates very
Panic.
yes, it creates panic. So, in any case, one cannot stop people from giving their opinion. However, a better, a sensible approach would be to seek another opinion or to go for testing.
You've described all of this, like women go through so many things. What should we keep in our mind? We tend to ignore a lot of things. So,
So maybe I can ask the family members to maybe help out or take care, maybe the husbands to be a bit more attentive, to just do not assume that it is due to. See, women face problems because of the weight issues as well. I hope I'm not being offensive to things. It is a problem, right? And a lot of breathlessness problems are due to the weight issues, and because of pregnancy, because of weight gain, your stomach also comes up, and your there's a hernia as well, hiatus hernia. So all these things they add to the symptoms. So sometimes आपको ऑलरेडी कुछ प्रॉब्लम्स हैं, यू आर सिम्टोमेटिक बिकॉज ऑफ दैट, इतने में अगर कोई और इशू भी हो रहा है, यू मे कंफ्यूज इट विद देम, कह रहे तो पहले से ही था, व्हाट्स न्यू. So you may end up ignoring your problems.
I think we'll just wrap up by saying like women need to pay more attention to the tests they need to get done. The people around them need to pay more attention to how they are feeling and just keep things in check.
Yes, I think we can put it on the family as well.
Yeah.
Maybe the husbands.
Great, great, great. Thank you so much, Doctor. Thank you so much for your time. It was lovely speaking with you. And I'm hoping all the women listening there are like going to pay attention to their heart health now.